today we will be discussing on the topic of shock. Now, the term shock is something different for the non-medicals and it is completely different term for medicals. Now, what is shock? Shock is not a disease. Rather, we can say that shock is a syndrome or it's a state of a person with the combination of two. One is decreased tissue perfusion, another one is impaired cellular metabolism. So, whenever I say this is a state of a person or a syndrome, it is combined of the two things. One is perfusion. So now, what is perfusion? Perfusion is nothing but the blood of body fluid is circulating and getting supplied or reaching to the target organ. So wherever it reaches, through the help of circulation, perfusion means it is reaching to the target organ and it is supplying the blood which is needed for our life. And then if the tissue perfusion is decreased, that means the enough oxygen is not reaching to the cell. So what will happen? There will be impaired cellular metabolism. What is metabolism? Metabolism is a process by which the cell or our body prepares or turning something into energy, food or fluid or anything, it is turning into the energy. So the two things, in decreased tissue perfusion, the blood is not reaching in an adequate amount. So the oxygen, there is a massive imbalance between oxygen demand and supply, for which there will be impaired cellular metabolism, for which the target organs will get affected one by one, and ultimately there will be death if it is not recovering, if we are not assessing it in a proper time and we are not taking the proper measure. Types of shock. So as we can see, there are main four types of shock. One is cardiogenic, one is hypovolemic, distributive. For distributive, there are again three subtypes. One is neurogenic, second one is septic, third one is anaphylactic, and lastly it is obstructive. So the all four names, from the names only, we can see this is cardiogenic because due to some cardiological factors or issues or disease condition, the patient eventually develops shock. That is the reason why we are calling it cardiogenic shock. Hypovolemic, hypovolemia. Volume is less, that means decreased volume. So it could be also of two causes. One is absolute, another one is relative. Later on we are discussing. Then distributive means there is no obstruction with the flow of blood or fluid, but still due to some other causes there are shock, like neurogenic causes. It may be due to a sepsis, or it may be anaphylactic, that means for an allergic reaction. Due to that it may happen. And lastly, obstructive. Obstructive means nothing but when there is a obstruction due to mechanical or non-mechanical causes and it is leading the patient to death, shock, that is only obstructive. Cardiogenic shock. The name itself defines that due to some cardiological issues, whenever shock happens, this is cardiogenic shock. Now the three main causative factors are there for the cardiogenic shock. What are these? Systolic dysfunction, structural problem, diastolic dysfunction. Now what is systolic dysfunction? The heart is pumping like this. If it is heart, then heart is pumping like this. It is contracting, it is relaxing. So whenever it contracts, if it is not able to contract properly, what will happen? The blood will not move forward. So what will happen? The stroke volume will decrease. If stroke volume is decreased, then cardiac output is decreased, and ultimately it will lead to decreased oxygenation and then decreased tissue perfusion and impaired cellular metabolism. Same goes for diastolic dysfunction. Diastole means it is relaxing, that means it is feeling. So if the heart is not able to fill up properly, where the blood will go? Because the heart is purifying the blood, right? It is coming in the heart, it is going to the lungs, it is getting purified, and then it is returning back to the heart. Now the heart is not able to fill the blood. What will happen? Will the blood will stay in the circulation or vessel blood? The blood will move back to lungs, right? So due to that, there will be pulmonary pressure will increase, and eventually due to that, the person will develop pulmonary edema. From that again, what will happen? Decreased oxygenation will be there, For that, decreased tissue perfusion and impaired cellular metabolism. So basic thing, and due to structural problem, both can happen. Structural problem refers to myocardial stenosis, myocardial regurgitation, valvular septal defect, like that. So from this, we can see if the blood is not moving forward due to systolic dysfunction or the blood is not refilled due to diastolic dysfunction, both can lead to ultimately decreased oxidation. Due to that, again, the definition of shock, what was there? Decreased tissue perfusion and impaired cellular metabolism will be there. This is the cardiogenic shock. Now, any shock pathophysiology, if we are discussing, we can see that ultimately this portion will be same. Fine. Because due to some causative factors, oxygenation will be less, tissue perfusion will be decreased, and due to that intercellular metabolism will be there. So the main part will be changed, this portion will be changed, and due to this portion the causative factor will varies, and according to that the name is given. Next, moving to the hypovolemic shock. Hypovolemic shock. Hypo means decrease and volume means we know. So whenever the volume, due to certain reasons, due to lack of fluid, due to lack of blood, when hypovolemia happens, from that also patient can lead to develop shock. So there are two causes, absolute, relative. Absolute means direct causes due to which there will be blood loss or fluid loss, like a patient had a severe head injury or an accident or hemorrhage. Like from that, whenever the patient develops hypovolemia, that is absolute. And relative means if there is burn injury due to that interstitial fluid, intestinal obstruction. For those causes, whenever patient develops hypovolemia, that time we are calling it relative cause. So both the causes, whenever the volume is decreased, the circulating volume will be again decreased. If the volume is not there, if the water or the blood is not there, what will circulate? So like that, there will be decreased circulating volume. Due to that, venous return will decrease. Now what is the venous return? Venous return means the amount of blood which is returning back to the heart. It is from the definition only we can define that it is directly related to stroke volume, which is directly related to cardiac output. So whenever circulating volume is decreased, that means the amount of blood which is returning to the heart is getting decreased, from which the stroke volume will be less and cardiac output will be less. Due to that, oxygenation will be decreased, decreased tissue perfusion will be there, and impaired cellular metabolism. Eventually the patient will develop shock and it may cause to death. This is the hypovolemic type of shock, which is neurogenic. The name itself defines that due to any neurogenic causes, like there may be spinal anesthesia or severe spinal cord injury, there may be cervical injury, or due to some pain or severe pain or usage of some drug, if it is having effects, there could be disruption of sympathetic tone. So the sympathetic and parasympathetic nervous system are actually controlling the vasodilation, vasoconstriction, the BP, the heart rate, like that. We all know. So whenever there will be disruption of sympathetic tone, what will happen? Vasodilation will be there. Artery and vein will dilate. Due to that, whenever vasodilation is there, what will happen? BP will fall. We know whenever vasoconstriction is there, BP will increase. Whenever vasodilation will be there, the BP will decrease. So due to that, again, stroke volume will be affected, it will be decreased. Due to that, cardiac output will be decreased, decreased oxygenation and tissue perfusion. Again, the same pattern as we told. Ultimately, this portion is gonna be same. It's a basic thing. Due to any neurological factor, sympathetic tone is getting affected. Due to that, BP is getting vasodilation. Due to vasodilation, ultimately again the same thing. Stroke volume is getting decreased and cardiac output is getting decreased, and then shock happens. Next is septic shock. The name itself defines that due to any sepsis, that means infection, whenever shock happens. Now, how from an infection the patient can develop true shock? We will study this on. So, invading microorganisms. So, whenever the microorganisms are in our body, they will do some. There will be release of some pro-inflammatory cytokines like tissue necrotic factor, interleukin 4. There will be endothelial damage, and due to microorganism, there will be activation of CNS, central nervous system and endocrine system. From that, what will happen? There will be peripheral vasodilation. Due to that, capillary permeability will be more because of the body is now not alone. They are fighting with the organism. The organisms are there, they are having a hypermetabolic state. Like, for example, whenever we are having infection, we can see we are having fever and we are very lethargic. Why? Because the energy, extra energy is going to that microorganism because body had to fight with that. So the patient will have hypermetabolic state at that time. So there will be selective vasoconstriction as well. So due to these four reasons, there will be peripheral vasodilation. Permeability will be increased and selective vasoconstrictions also will be there. Ultimately, it will lead to maldistribution of blood. So blood is not getting supply, circulating. If it is not circulating, then decreased oxygenation will be there. Ultimately, tissue perfusion will be affected and there will be impaired cellular metabolism. From that, the patient will develop shock. Now, anaphylactic shock, anaphylaxis, hypersensitivity, right? So whenever due to any dye or in food allergy or allergy from drug, if there is any kind of hypersensitivity reaction, from that the patient eventually can develop to anaphylactic shock. The same reason, due to that hypersensitivity reaction, there will be some reasons the body will try to cope up with that and the body will not be able to do so. So whenever that happens, there will be decreased blood supply. Due to from that, again the same thing, the oxygenation will be decreased and tissue perfusion and metabolism will be affected. So this is about anaphylactic shock, and one more left is obstructive shock. Stays the last one. Already we have discussed about cardiogenic shock, hypovolemic shock, distributive shock. Among that, three of the shock, the neurogenic, septic and anaphylactic we have discussed so far. And now obstructive shock, it is clearly, the name is indicating that there is, due to some reasons, there are some obstruction. It may be due to mechanical or non-mechanical causes, blood or body fluid is not able to circulate. Due to that obstruction, what will happen? Again the same thing, venous return will get increased. If it is decreased, then stroke volume will be less, cardiac output will be less, decreased oxygenation, ultimately tissue perfusion will be decreased and impaired cellular metabolism, and patient will show the features of shock. So this were all types of shock we have discussed. Is the stages of shock. Now, whenever shock happens, there are certain changes in our body. But as we told that it is a state, it's not a disease, certain stages will be there through which the body with its organ will face some changes. So, first stage is initial stage, when the problem just began, the etiological factors were there. So what happens? It just in a cellular level, a certain changes are there, like there is a shift of metabolism from aerobic to anaerobic. Means in the absence of oxygen, the metabolism will start. Because your body needs energy and metabolism should be there to make the energy. So that due to that, if oxygen is not there, then also what the body is trying to do is doing the metabolism without oxygen, right? So it will shift to aerobic to anaerobic. In this stage, the fewer symptoms are only there. It is not very effective or it is not very visible during this initial stage because changes just starting. Next is the compensatory stage. Now, anything if it is happening to our body, if we are observing a person is coming in front of us with a knife, so what we will do? We will escape from that situation, right? We will run away. Like that. If the body is sensing that there are some changes, there is something wrong in our body, it will try its best and it will activate the from the central nervous system to the endocrinal system and biochemical system, biochemical mechanism to restore the normal function, because we are supposed to stay in an equilibrium state. We are supposed to maintain a homeostasis. If it is not there, the body will sense that and body will try to cope and it will try its best to cope with that particular thing. In this stage, there will be some compensatory mechanisms which will show, which will visible by some symptoms. Now, if the compensatory mechanism fails, then the patient will eventually go to progressive phase. Progressive, the name itself defines that the person will get so many complications at this stage that it is very critical to manage that stage. Now, the progressive stage, if it is not again managed, the last stage of shock, which is refractory stage, from which very fewer patients revive, right? Because it is a type of stage where your body mechanisms failed. Now you have been in a progressive state where your system by system is getting affected. Now there is nothing to do. Now very rare cases the patient can survive from this stage. So these are the 4 stages. We will discuss one by one. The initial stage, already I told that the fewer changes will be there. Only the metabolism will shift from aerobic to anaerobic. Nothing more changes will be there. The next stage is, as I told, compensatory stage. Now the body will try to assess that something is wrong and it will try to compensate whatever wrong happens to your body. So first thing, what your body will do? Activation of central nervous system. It will get affected. What will happen? CNS activation, due to that sympathetic nervous system will get activated, which will activate the baroreceptor and it will activate the vasoconstriction. Because at this stage, as the circulating volume is very less, the body will try to at least supply the 2 major organs, which is heart and brain. If the heart is not working properly, then also blood supply will not be there, and if the brain is not working properly, then also it will be a massive, if it is leading to brain death, then also it is difficult to survive. So at this stage, the body will do activation of sympathetic nervous system, it will vasoconstrict, it will activate the baroreceptor and it will try to retain the blood and it will try to give the blood only to heart and brain. And the shunting of blood away from the other organs like lungs, skin, GI tract, and from the symptoms, whenever we will discuss about the symptoms, we all can see what are the symptoms. We will relate how and why it is happening, because your body is shunting away. It is trying to cope up the mechanism of retaining the volume. So that is why it is vasoconstricting, it is baroreceptors getting activated. So the blood will at least retain and at least it will supply the 2 major organs, heart and brain. But as the volume is not getting supplied to lungs, skin, GI tract, we can see from lungs the patient will develop some sort of dyspnea. There will be respiratory acidosis will be there, cyanosis will be there. Then for skin, the shunting away of blood or pulling away the blood, the skin will become cold and clammy, which is a classic sign of shock. Whenever the patient will be in shock, we can see the hands, feet, the extremities are extreme cold and clammy by touch, because the skin is not getting supplied the blood. Then GI tract, we can assess the patient is having bowel sound is decreased, the patient might develop nausea or vomiting, and there might be other metabolic system will be affected. There might be metabolic alkalosis or acidosis, or sometimes respiratory acidosis, alkalosis, like that. In this stage, the motto will be to keep the heart and brain alive, to keep the heart and brain safe. If it is safe, then only the body will survive, and then only later on we can revive the other things, the other organs, right? Next stage is the progressive stage. As we have discussed, the compensatory stage is body tried to cope up, applying its all mechanism to cope up with that particular crisis, but it was not able to do so. So that's why your body eventually developed to the progressive stage. Now in the progressive stage, there will be little more symptoms, there will be worsening. In the compensatory mechanism, there was no involvement of the central nervous system, there was no changes of the mental status, or there was no confusion. There was definitely anxiety or agitation was there, but confusion, disability, it was not there. In this stage, particular the classic symptom, when we will call a patient in shock is in progressive stage, whenever we can assess there is a massive changes in the mental status. That time we can tell. So first, the CNS, there will be changes in the mental status. Next, for cardiovascular system, the body again will try to cope up and it will do the vasoconstriction. more and more will be, but it is not able to, so the BP will be very less. Mean arterial pressure will be less than 65, systolic blood pressure will be less than 90. And heart rate, as a compensatory mechanism, heart rate will be increased, tachycardia will be there. Although the patient will not able to maintain a normal BP, still there will be tachycardia. Next is pulmonary. It's very important. In early stages, we have read that there was a lack of blood supply to other organs except these two, right? The body tried to maintain a normal blood supply to the central nervous system and cardiovascular system. But in this stage, already it was reduced in the lungs. Now it is getting worsened, more and more decreased. So it will result in vasoconstriction. Pulmonary vasoconstriction will be there. Pulmonary edema will develop more. Pulmonary pressure, pulmonary artery pressure will be more, and bronchoconstriction will be there. Due to that, what will happen? The pulmonary, due to increased pressure, pulmonary edema will be there, and it will lead to impaired gaseous exchange. The two gases, oxygen and carbon dioxide, which is getting exchanged in the capillaries, it will be severely affected, and there will be ventilation perfusion mismatch. The blood which is coming and which is getting absorbed, there will be a mismatch among that. So the symptoms will be like that. Next is kidney. Already in the compensatory mechanism, the blood was decreased, so urine output was less. But in the stage, due to renal tubular ischemia, it will eventually lead to acute kidney injury. So there will be urea, creatinine, blood urea nitrogen will be deranged, creatinine will be deranged, waste product will be more in this stage, and there will be signs of acute kidney injury. Hematology, ultimately there will be bleeding disorder and disseminated intravascular coagulation, DIC, which is a term we can discuss about later. It is a state of, it is a blood disorder, bleeding disorder we can say. Next is GI tract. There will be mucosal barrier ischemia. There is every organ, they have a protective mucosal barrier. Now the GI tract, the profound decrease of the blood supply, due to that mucosal barrier ischemia will be there, GI bleeding will be there, and the GI system will not be able to absorb the nutrients in this stage. So this is about the progressive stage. Initial stage, compensatory stage, it was signs and symptoms were there, but in the progressive stage, advanced signs and symptoms was there, as the compensatory mechanism was not able to maintain the normal homeostasis. Next is the refractory stage. This is the ultimate stage from where there are few patients only survive. Now, this is the most critical and final stage of shock, where the body tried to compensate, it was not able to, so the body went to the progressive stage, and then also it couldn't be managed. So what happened? Due to massive decreased perfusion, anaerobic metabolism will be there. There will be production of lactic acid, more and more lactic acid will get accumulated. There will be there will be increased capillary permeability more, and loss of intravascular volume will be there, which will lead to worsening of myocardial depression, because due to loss of intravascular volume, hypotension will be worsened, tachycardia will be worsened. Now, what will happen? The worsening of myocardial depression will be there, led to severe cerebral ischemia, from which it is difficult for a patient to survive this stage. This is the final stage and the most critical stage. So, this were all of the four stages: initial, compensatory, progressive and refractory. So, from this, if the pathophysiology of shock is there, we need to define every stages. We need to write down every stages with the consequences, or with the, as we have discussed this.